Welcome to another episode of Perfectly Imperfect Health. I'm Guan.
And I'm Shell.
Hey, Shell. Are you a coffee or tea drinker?
Tea for sure.
No coffee for you?
No, hell no.
Why?
Teh tarik is the best, man.
I mean, I like teh tarik, but if I don't drink coffee for one day,
Yeah.
I'll get this pull in my head. It's like a tension headache.
That's
Do
terrible.
you get those if you don't drink tea?
No, never.
Yeah.
It sounds like you have an addiction. Like, do your
Yeah.
hands tremble?
No, but I do get that headache. But do you get headaches in general?
I think my whole life, like maybe 5 to 10. Like, definitely
Are
less
you
than
sure?
10. Yeah.
I think I want to call your bluff. Let's welcome our expert today, Dr Nijanth from National Neuroscience Institute at SGH, our neurologist.
Thank you,
Dr
Guan and
Nijanth,
Shell,
are you
for having
coffee
me
or
here.
tea person?
Me, I'm a bit of both. I do
Oh.
drink coffee as well as tea, but I would like tea a bit more better than coffee.
Do you get headaches?
I seldom get headaches. I'm blessed in that way. Though I am a headache expert, unfortunately I can't share the same sentiments as that of my patients.
Yeah. I
Yeah.
guess you know the
Unfortunately.
pitfalls of avoiding a headache. Can you explain to me why I get this coffee headache thing?
Okay. So, coffee has this psychostimulant substance called caffeine that we all know,
Yes,
right?
caffeine.
Yes.
Yeah, it's very important in our lives. Yeah.
Tea also has
Yes,
caffeine in
tea
it,
is-
Yeah,
right?
yeah.
Yeah.
But then the concentration of caffeine in the coffee and tea varies,
Mhm.
and roughly you could say that a cup of coffee would have twice the amount of caffeine as
Yeah.
what is there in tea.
Mm.
And if you are a person who consumes regular amounts of caffeine on a daily basis, let's say 3 or 4 cups, which will equal to about 200 to 300 milligrams of caffeine a day,
Mm.
in due process your body will develop some kind of a habituation or addiction to this chemical,
Mm.
caffeine. And then if you're going to go and stop taking this caffeine, then you're going to face this small trouble there, which would be your caffeine withdrawal headaches. Yeah. But
Yeah.
surprisingly, caffeine also has its analgesic or pain relieving properties.
Mm.
When you combine caffeine with medications such as paracetamol or
Mm.
aspirin, it
Mm.
boosts the efficacy of these medicines
Oh.
and can even relieve you of a headache. So it is
Wow,
a
okay.
two-edged sword.
Right.
If you use it in the correct scenario, it helps with headaches. But if you are addicted to it, then it doesn't really give you relief, but rather causes headache.
So, how many different kinds of headaches are there actually?
Okay, so broadly you could divide headaches into 2 flavors.
Mm.
In line with
Flavors.
the caffeine and the tea.
Okay.
Okay.
So one
Right.
would be primary headaches,
Mm.
and the other would be secondary headaches. That's what doctors call it.
Right.
Okay.
So what are primary headaches?
Mm.
Primary headaches are conditions which are an entity by themselves. So there is no other disease or a medical condition causing this headache, but the headache itself is the disorder. And the vast majority of headaches are primary headaches.
Which
So-
is the not so serious ones? Can you
yes,
say
you're right.
Yeah.
So this could be called as a benign or the harmless headaches,
Okay.
but they could be quite disruptive, especially headaches such as migraine. I'm sure you've heard of migraines.
that? Oh yeah, the M word. Yeah.
Yes. So migraines, even though they are classified as primary headaches, they can be quite disabling and disruptive,
Right.
and patients can even miss a day's work. They can miss social activities, and it can be quite disabling. So primary headaches, if you want to know a bit more about them,
Mhm.
have you heard of any other headaches besides migraine? Can you name a couple more headaches?
Splitting headache.
Tension.
Okay, tension
headache.
headache, splitting headache,
Throbbing.
throbbing.
Yeah.
Okay, throbbing and splitting are probably terminologies of how we describe the character of pain.
Yes.
Okay.
Yeah.
But a tension headache probably is the most commonest type of headache.
Yeah.
Okay, and it also falls under the primary headache category.
Right.
Mm.
So about 70 to 80% of all headaches are tension headaches. So
Right.
if somebody
Wow.
walks into my clinic,
Yeah.
1 out of 2 patients is
Mm.
going to have tension headache.
Mm.
And why is it called tension headache?
Yeah.
Do you guys know the reason?
Because
Well,
I
for
don't
me,
know.
it's because I feel this pull in my head, so there's a bit of tension, I think.
Okay,
Yeah.
so you think it's the tension in that
Yeah.
region?
Yeah.
What do you think, Shell?
Because
Why do you
I
think
have
it's
no
called
idea.
tension?
it develops
Why?
when you
'Cause-
have tension at home.
Let me give you a clue. It's also called as stress headaches.
Or
Oh,
stress
so
headache.
it's when you have stress or when it's brought on by stress?
Yeah, you could say that. So the To be very honest, the
Yeah.
exact mechanism of tension headaches is still being debated, but what we understand now is that it arises from some form of excessive stress or tension,
Yeah.
predominantly to the muscles in the neck and also in the scalp. Okay, so that is where the tension is. And why would anybody have tension, abnormal tension in the neck or in the scalp muscles?
Like they get tensed up, like maybe their
And,
posture.
yeah, maybe you didn't
Yes, she
sleep
got
well at
the
night.
she got the right word.
You didn't
Yeah.
sleep well at night.
That
then,
you
Yeah,
will.
so
yeah.
poor posture
Yeah.
is one important reason. Okay, so poor
right,
posture.
Right, okay.
Secondly, why do you think the muscles around the scalp, especially in the frontal region, can get tensed up? Usually because of eye strain. Okay,
Eye strain.
Oh.
eye strain. So
Right,
it could be too much screen time. You have some refractive error and your glasses don't fit you. Okay,
Ah.
or you are in an inconducive environment, too much heat or too much light, and you're frowning. So all these activities put your muscles under undue tension, and usually it's a harmless headache. It should just go away, but
Yeah.
it just recurs again and again if you do not take care of the underlying cause. So you need to watch your posture. We briefly spoke about migraines. Do you guys
Yeah.
know anything else about migraines? Any of your family members or you yourself have migraine?
Oh my gosh, my husband.
Yeah, I think
Yeah.
Shell's husband probably has a migraine.
It's terrible.
Yeah.
Like I think a couple of months ago,
Mhm.
he just woke up in the middle of the night from like the migraine woke him up, and then he couldn't sleep, and he was trying to get into a posture. And then he told me, like, I was asking what's wrong. He was like, "Don't talk, just."
He
keep
didn't want to be
quiet, just-
disturbed.
I don't
Okay.
hear anything. Yeah, and it was really bad for like hours and hours and hours. I've never seen it like that before.
I see.
It was crippling. Yeah.
Mm.
So,
Yeah.
so migraine is also a primary headache.
Yes. Yeah, so
Does
I
that
think
sound-
Shell kind
Yeah.
of expressed the essence of what a migraine patient undergoes whenever
Yeah.
they have an episode. It is a very significant problem. If you look at health statistics, it is labeled as the third most disabling disorder in alignment with other conditions like such as stroke. So
Right.
how often do people
Wow.
think that migraine is such a disabling disease, right?
Yeah.
So migraine is a complex disorder, and to put it into simpler terms, you could imagine there is a chemical storm happening inside your brain when somebody
Chemical
has.
storm. That sounds very
Yes,
serious. Chemical
Yeah.
storm.
Yeah, so
Right.
there are at least more than 5 to 10 various chemicals. As a simpler way of putting it, there are
Yeah.
neurotransmitters, vasopeptides, fancier words for chemicals
Right.
Yeah.
that basically are playing something like an orchestra within your brain. Okay, and this orchestra is not going to stop.
It's not a good orchestra.
Yes,
Doesn't sound good, yeah.
yes, and it usually goes for more than 4 hours, okay, and can last up to about 72 hours or 3 days. So these patients, when they have a migraine episode, are usually quite distressed. So they have a moderate to severe throbbing pain, like one of you mentioned, right? Like when I asked the type of
It's
headache,
like a
one of you said
pulsing,
throbbing.
like-
Yes, so throbbing is essentially like a pounding or a pulsating quality to it. And sometimes, most often it is unilateral, but it could be bilateral, which means both sides.
Yeah.
And many times, how do doctors find out that this is a migraine is when the patients tell there are some associated features. So what are the associated features? Feeling a sensation of vomiting,
Yeah.
Right.
feel
People
like
wanted to
vomiting,
throw
which is
up,
nausea,
yeah.
that's
Yeah.
one. Then many migraine patients will have sensitivity to light and sound, which you call as photophobia and phonophobia. So sometimes this is it can be quite subtle. So if you
Right.
observe a patient with migraine, they will just silently go and put the curtains. Okay, they might just gently go and switch off the light.
Yeah.
And when you want to ask them in a very caring way, like what you did to your husband, how can I help you, they will just tell you, please don't disturb me for a while. Okay,
Right.
it's just because they don't want to hear any
Any sound at all.
sound that is troubling them. Okay, so this goes on for a while, and subsequently the migraine attack will stop by itself. In some patients, unfortunately, the migraine attacks can be even more flavorful. Where they,
Flavorful. Why is
yes,
it more flavorful?
so they get this additional set of symptoms
Right.
called aura. Okay.
Aura.
Yeah.
Oh, you're using
Eh,
very descriptive
Yeah, I know,
words
I know.
here.
My goal here is to drive all these fancy words in a very simple way.
Yeah, okay.
So
okay.
everybody knows about this, and we all
Right.
are, educated about these
Sure.
terms. So aura essentially means a special set of symptoms.
Right.
It can be in the form of the commonest aura is when you see like flashes of light.
Wow.
It could be zigzag lines or flickering dots.
Right.
And sometimes even the images can become smaller or larger.
Wow.
There
sounds
is
like
even,
science fiction.
I can tell you something very interesting. So,
Okay.
you all have heard of Alice in Wonderland?
Yes.
Yes.
Have
The
you
blue
have
pill
you read
and
the
red
book?
pill.
Read the book,
Yes,
watched the
okay.
movie.
Yeah.
Yeah.
Yes. So, what gist of what happens there with Alice becoming very tall
Yeah.
and shrinks down?
Yep.
There are these. There's a theory, meaning it's not proven, that the author C.S. Lewis probably
Yeah.
had migraine episodes,
Wow.
and
Really?
Wow.
he had this abnormal perceptions of matter,
Right.
and it helped him to pen this down. But
Wow.
of course, this
Right.
is a theory. I don't think
Yeah.
it is
Right.
proven. Visual auras are quite common, but there are some other auras which can be a bit more troublesome and even challenging for the physician.
Right.
One is vestibular migraine,
Yeah.
where patients can have dizzy spells, okay,
Mm.
and it's often confusing. Many times patients go to the ENT doctors or the ear doctors with recurrent dizzy spells, your scans and your blood tests all come out negative, and finally a neurologist will have to make this diagnosis of vestibular migraine. And there's another worse scenario where patients suddenly develop weakness and numbness, mimicking almost like a stroke,
Mm.
and that is quite a challenging condition as well. Only if you have a very strong history of migraine with similar episodes in the past, or even doctors, we are able to tell a migraine episode from a stroke. On a first
Right.
presentation, it will be very challenging for us to even differentiate a stroke from a migraine.
Right.
Yeah.
So, is it right to say that headaches are not so serious, but migraines you need to treat them a bit more seriously?
Yes,
That's-
you are
yeah.
you're right. Okay.
Yeah, impression I
So headaches, we briefly touched upon primary headaches, right?
Yeah.
have.
So there are a myriad of headache syndromes, at least 100 of them. But the common ones are tension headache. It is important because it's the commonest one, so it's good to
Okay.
know about it.
Yeah.
But migraine, the incidence of that is not so common, but it
Right.
is still 10% of the population, which is still a big number, right?
10% is quite.
It's
yeah,
still a big
1 in
number.
10 is still
Yes.
Yeah.
Quite
So,
often,
so
yeah.
if you consider the world's population as 8 billion,
Yep.
you're going to have 1 billion people with migraine.
Migraine.
Okay.
Well, if we put it that way, yeah.
Yes, so we are going to have 1 billion people with migraine. In Singapore's population, our statistics say that we have 1 in 10 people
Mm.
suffer from migraine.
Mm.
The unfortunate part is 1 out of 4 people don't even seek treatment for it. They are just suffering in
Wow.
pain somewhere.
They
Okay.
probably just pop pills like paracetamol and.
Yeah, they could do
Yeah.
that. There's also this hypothesis that Asian people do not like to
See the
reveal,
doctor.
do not like to
Or
see
show
doctor.
weakness.
Yeah, don't show weakness. Don't show,
yeah.
especially the men. They
Especially
don't want to
men,
say,
yes. Like your
oh, I
husband.
have headache.
Like for me to self-diagnose, right? How would I know that I'm having a headache or a migraine?
So diagnosing migraine is a little bit, I wouldn't say difficult, but
Mhm.
the process can be simplified. Okay.
Okay.
So there's a questionnaire that was brought forward by one of our headache specialists a few years ago. It's called the ID migraine questionnaire. It can be easily Google searched. It basically asks 3 questions, and if you have 2 out of 3 questions, then there's a 75% chance or a high likelihood that you have migraine. Okay.
Okay.
One is, along with the headache, you have a feeling of vomiting sensation or nausea.
Mhm.
So if you have that, you get 1 point. Okay.
Okay.
Mm. Okay.
So if you have sensitivity to light,
Mm.
Yeah.
you get another point.
Right.
Okay.
And the third
And the
point?
third point is if you are disabled. That means you are not able to go forward and do your routine
Normal work.
activity or work
Yeah.
when you are having the migraine
Yeah.
or headache, then you get the third point. So even if you have 2 out of 3 along with the headache that recurs again and again, then you could consider yourself to have migraine and seek help. When you have a migraine, basically your brain goes into a sensory overdrive.
Mm.
Your brain is basically picking up every signal
Wow.
around you and it's over processing it. Okay. Some patients can clearly tell that when they have red wine, they will surely get a migraine.
Oh, they have
Or if they
triggers.
have a chocolate, they will have
Yeah.
it. Or a particular strong, I had a patient who said, strong guy's perfume.
Wait,
Gives me-
hang on. Strong guys or strong perfume? Or strong guys perfume? The perfume is strong,
You
lah.
could take it.
Not the guy.
You could take it whatever way
Okay,
you want.
okay.
Okay.
So,
So,
yeah,
Yeah,
so their smell is
strong
a huge
Yeah,
trigger.
yeah. So these,
Yeah.
so some people say the barbecue smell,
Oh,
the
barbecue smell.
MSG. So,
Wow.
so it's like a personal journey that you can go and identify your own trigger.
Wow.
Yeah.
And if you can avoid that, then you could prevent your brain going into this overdrive and causing this chemical storm and you thereby suffering.
And it can be anything, right? It can be any trigger for any different.
Yes, but there's a
different
common denominator,
Yeah.
which is things like poor sleep. Okay, that's a standard.
Oh,
Right.
poor
So
sleep.
everybody who is going to sleep for 4-5 hours and spending
Yeah.
long hours in the
Mm.
computer,
Yeah.
it's going to be the common denominator.
Yes.
Then weather change, dehydration, these
Mm.
are common. But then food items and things
Yeah.
like that are a bit more personal.
Right.
Okay, and another important fact is that migraines are more common in women, right? 3 times more common in women. Essentially, the hormonal swings, especially the estrogen levels going up and down,
Mm.
Right.
also causes migraine. Okay, that combined with the other stimuli. Okay,
Mm.
that is why women it is as high as about 15 to 20%, whereas in men it's about 5 to 8%
Wow.
prevalence
Michelle,
of
have you had
migraine.
a migraine before?
No.
So that's just all
quite
the
lucky.
lucky
She's
people.
quite lucky.
who
There are
never
some
had
stats
migraines.
also which say
Yeah.
women in their reproductive age group, which means 15 years to 45 years,
Yeah.
1 in 3 of them have migraine.
Whoa.
Yeah,
Wow.
so if you do not have it, then it is quite good.
Dr. Nijanth, so earlier you were talking about secondary headaches as well, right? Could you expand a little bit more about those?
Sure.
Yeah.
Secondary headaches are the real villains of headaches. Okay, but fortunately for us, they are much lesser in proportion compared to the primary headaches.
Okay.
So you're looking at about 10 to a maximum of 20% of all headaches will be secondary headaches.
Mm.
And what are secondary headaches? These are headaches that basically arise from an underlying disease of the
Disease,
brain
oh.
or the surrounding structures.
Right.
Okay, so you have some simpler secondary headaches
Mhm.
like sinusitis. Basically, you have a infection of your sinuses,
Mm.
or you can have dental infections.
Right.
Also, can give rise to headaches.
Yeah.
So these are all.
Yes.
If once you take care of this problem, the headache is going to go away.
Mm.
Whereas primary headache, there's no underlying disease for you to fix.
Right.
So it's just going to be a recurring theme. Whereas secondary headache, you fix the problem, most likely you're going to get rid of that headache problem. Okay.
Okay.
So like I mentioned, simpler ones are sinusitis
Mm.
or dental infections. Even infections like dengue and COVID also can give rise to headaches. They also fall under the secondary headache category.
Mm.
But the important ones, the nasty ones,
Mm.
are the ones that most people are worried about when they come to see a doctor.
Brain tumor.
Right? Yes. So everybody who sits in
Yeah.
front of me wants to do a scan for the
Yes.
brain,
So when would you advise somebody that
to have a brain scan.
exactly?
So if you have a headache that has other features like you have new weakness, you have speech difficulty, or like I mentioned, there's a pattern change and many associated features,
Mm.
then you would be worried. Okay,
Mm.
and then
Okay.
the doctor also is going to be worried. When he examines you, he will be looking for certain signs as well, and it's more like a combined decision that you and the doctor will have, and then the doctor will decide if you should go for a CT scan or a MRI scan. Essentially, if you look at the numbers, there's only a 0.1% chance, going by general statistics, that you might have a headache from a tumor. That is, if 100,000
Mm.
patients are going to walk into clinic, one of them is going to have a headache from a tumor.
Yeah, that's true. But what happens
Yeah,
if
you
you,
could
if
feel
you
like
are
there
the
might be that
one?
one.
Yeah, that's true.
Yeah,
That's
there's
true.
always like a bit.
But what I want to
paranoia.
say is that
Yeah.
not a majority of the headaches are from tumors,
tumors,
but
right.
rather
Yep.
less sinister causes. So you could still, trust the doctor. If his judgment is that you do not require the scan,
Mm.
and if the process of examination history was quite thorough, I think you should leave it up to the doctor to decide that. And of course, be watchful of your headache. Okay, at that point in time, it might not have been very sinister, but any headache is important. That is what I would say.
Mm.
Only if it is very mild, infrequent,
Yeah.
you can just maybe keep it on the side. But anything else, you just need to still need to monitor the headache and take it seriously and seek appropriate advice and medical help as needed.
Right. I'm guessing for headaches we can take the paracetamols or aspirins, but for migraine, can you take the same thing? Does it work?
Yeah.
Okay, so there is this one question, right? So
Mm.
when do you take your own medications or self-medications,
Yeah.
and when do you
Yeah.
seek doctor's help, right? If you have less than one headache a month, or maybe even one headache every
Like-
3-4 months,
Yeah.
and if it's not severe, okay, it's a mild kind of headache. It's even better if you know the causative factor or the
Mm.
trigger that caused the headache. Like maybe you had a a rough night's sleep, or you were stressed because of exams, and then you had a headache, and it's mild and it's
Yeah.
infrequent, go ahead and hydrate yourself, rest, and take some paracetamol or something simple. Okay.
Mm.
But if you have a new headache, so if the pain score is as high as 9 or 10, which peaked within few minutes to seconds,
Wow.
and that is called a thunderclap headache. Okay.
Thunderclap.
Thunderclap
Wow.
headache. A lot of fancy
I love
terms.
all your
Yeah.
Yeah, I
beautiful,
know.
beautiful
Yeah.
descriptions of headaches and in
Headache
general.
medicine is
Because
quite
it comes
clever.
on suddenly like thunder.
Yes.
Right,
Okay.
right. That must be horrible.
Yeah.
Yeah.
So this thunderclap headache is no joke. Okay.
Right.
And if a person does have thunderclap headache, more often than not, they will have a secondary headache, which is a more sinister or a dangerous headache.
Right, so
Right.
it's like tumor.
Yeah. So it could be, most often it is actually a bleeding within the brain that
Right.
causes this thunderclap. Okay.
Mm.
So it could be an aneurysm that broke, or
Oh my
some other
gosh.
kind of a bleeding. And there are a few other conditions like blockage of the venous system inside the brain. All this could cause this thunderclap headache. So
Mm.
if you've never had headaches in your life, but
Mm.
on one fine day you have this very bad headache
Something's wrong.
and it is 9 or 10,
Yeah.
then you better go seek help. Okay, that is one.
Okay.
Number two, you're a person who gets recurrent headaches,
Mm-hmm.
but you have now a sure change in its pattern. Okay, which means, let me give you an example. So you have headaches every month, 1 or 2 headaches a month. Maybe you have migraine. Okay,
Yeah.
it lasts for, your migraine lasts for 1 day max, and if you sleep and wake up the next day, it goes away.
Mm-hmm.
Or you pop in 2 pills, it goes away. Okay, but now you have this headache which started 2 weeks ago and is not gone away, and is only
Okay.
getting worse and worse with time. Okay, and maybe now when you walk, you feel a bit wobbly, or any of these new symptoms that come.
Mm-hmm.
Even if you are a veteran of headache with 20 years experience,
Veteran.
this new headache is going to be an alarming one. Okay, so for this headache you need to seek help. So in summary, if you have a new headache which is very severe,
Mm.
okay, remember the word thunderclap,
Yeah.
Thunderclap, yeah.
or if you have a new change in pattern which is drastically different from your usual headaches, these are 2 occasions where you should seek the help of a doctor.
Mm.
If it's mild, infrequent, you know the cause for the headache,
Mm.
then it is okay to take care of yourself without seeing a doctor.
I
But
think so.
can we take paracetamol for migraines?
Migraines.
Okay,
Yeah.
so when you talk about the treatment of
Mm.
migraine, I can talk about it for easily half an hour, but I will try my
Probably need
best to.
another podcast, but
Yeah.
maybe you just sum it up for us.
Okay, so there's been significant advances in every frontier, right? Science, medicine. So of course the treatment of migraine also has evolved. But for the past 50 years or so, in the post-antibiotic and modern medicine era, the medications for migraine, however, were not specifically designed to treat migraine, but rather they were medications that were treating other conditions like BP lowering medicines,
Oh.
or antidepressants or anticonvulsant medicines. But these medicines were the ones that were also used to control migraine frequency. Okay, these medicines are good. Okay,
Yeah.
they've been used for close to 50 years with a decent effect. But the caveat here is that when you use these medicines for a long period of time,
Mm-hmm.
it comes with its own bundle of side effects, right?
Mm.
So things like weight gain, depression, and few stigmata that many patients do not want at such a young age group, right? So with recent advances in science, from year 2018 onwards, you have this newer group of medication called as anti-CGRP medicines. Again, some fancy word.
Basically new medicine.
Yeah, new medicine. Okay, let me just state it for the sake of
Sure.
saying it. It's called calcitonin gene receptor peptide anti-CGRP. Okay,
Okay.
so essentially these newer molecules
Mm-hmm.
basically exactly act on the mechanism of migraine. Okay,
Mhm.
it has been understood that when a person has migraine, these levels of this CGRP compound is on high levels. So when
Sure.
you give this anti-CGRP, it kind of
Calms down.
yes, yeah. So it helps manage the migraine episode, and most of these medicines are very effective. They are very minimal side effects,
Mm-hmm.
but most of them are actually injections. So there is a little bit of a
Ah.
Right.
tricky point there that
Right.
many people who do not like.
Yeah, so if you scare injections,
injections,
you
right?
can't take that.
Yeah, but the good part there is these injections are not daily. They are like once a month or even once in 3 months.
Right.
That's okay.
But there are
Is
some
that okay?
Yeah.
Okay.
there are some newer like oral options as well, especially there are a few that are coming in now. One called Rimegepant, which is this medicine can be taken both for acute attack as well as a preventative medicine. So preventative means you take it on a regular basis. If you have or don't have a migraine, you still take it
Just take.
to protect
Right.
against the next attack.
Right.
Whereas the acute is when you are suffering from attack, you take the pill to manage the attack and make it less severe.
It's like when you have asthma.
Yeah, you
Is
could
it?
say that.
Oh, it's like with asthma.
Yeah,
Right, right.
yeah, but in asthma you use inhalers, but here you pop a pill. And the Rimegepant tablet is a orally dissolving tablet, so it just dissolves in your tongue and your mouth, and it's quite effective. And but patients have their own choices. There are many young patients who still like to do the injections.
Oh,
Some
really?
like to do the
why do they like to take the injection?
yeah. So we were also initially a bit intrigued, but when you ask them
Yeah.
as to why do you prefer to take an injection, sometimes they say we don't want to be reminded to be patients taking medicines on a daily basis.
Oh, that's the reason.
Yeah, they
Really?
rather just jab once
Get it
and
over
then
and done with.
for the next 30 days they don't think about anything else. Yeah.
Oh, that's interesting. Right, so we've learned a lot about headaches today. Any particular key point you want to drive home for listeners or viewers?
It is good for everyone to have adequate knowledge about the different type of headaches. I think it's very important because someone said headache is a human experience. As long as you have a brain, you will have headache. Okay?
Except for maybe very,
Very
few.
rare.
Yeah, yeah.
Okay.
Oh, yeah.
Yeah. Okay. So so it is good in the modern world where you have so much resources. It is good to know about the different type of headaches, but it is also important that you don't get very paranoid reading all those things that you read here and there. But like I mentioned, if you are a person or your close one has particular headache symptoms, you can use things like the ID migraine questionnaire.
Right.
If it does look like migraine, repetitive episodes, it is good to seek the help of a doctor, okay, so he can advise you as to what to do. There is a mnemonic called SMART mnemonic. Okay,
Smart,
yeah.
right.
So S is for sleep, M is for regular sleep, okay, M is for regular meals, A is for regular activities, and the other R is for relaxation techniques,
Okay.
and T is avoid specific triggers. If you know there is a particular trigger that makes you give you a headache, then you avoid that. So I think that's equally important. There's no point you load yourself with all the triggers and then pop a lot of medication, then go see a doctor. The
Yep.
best way to manage a headache is to cut down all triggers, take care of your health, have an optimal lifestyle, and thereby I hope that all our Singaporeans can live with headache-free lives.
I think that's all we want.
I think so.
Yeah.
Thank you, Dr. Nijanth, for
Thank
being
you,
on our
guys.
show.
Thank you.
And for everybody who's tuning in, you've been listening to Perfectly Imperfect Health by SGH. Thank you.
Bye.